Hello everyone and welcome to aidsmapLIVE, HIV and Unmet Needs. My name is Susan Cole and I'm thrilled to be joined today by an absolutely phenomenal panel to discuss HIV and unmet needs. So the needs of people living with HIV are incredibly diverse, but the extent to which our needs are met can really impact on our health and well-being. So I'm really pleased that this panel are joining me today to discuss that, and I'm going to bring them on one at a time to introduce them. So first of all, can I have Jide?
Hello, Susan. Thank you so much for having me on the program. I've been waiting for this opportunity. And my name is Jide Macaulay. I'm the founder of House of Rainbow. And of course, I'm also the chair of One Voice Network. And I'm also the chair of the International Network of Religious Leaders living with HIV. So today there's going to be a lot of conversation about unmet needs.
Wonderful. Thank you so much, Jide. And next, can I have Sophie Strachan?
Hi, Susan. Thank you very much for the invitation to attend today.
Hi, Sophie. Wonderful to have you on. For people who don't know Sophie, Sophie is the CEO of the Sophia Forum, a peer-led women's charity that's absolutely fantastic, so do check it out. Sophie's been providing peer support for 2 decades and works as a sexual health advisor at Chelsea and Westminster Hospital. She's been committed to ensuring gender and health equity in the HIV response throughout her career, and her special interests are sexual, reproductive health and rights for women living with HIV, research, people in prisons and homelessness. So thank you, Sophie. Wonderful to have you on. Next, can we have James Cole?
Hi, good afternoon. Thanks for having me on today.
Hi, James. Fantastic to have you. James is the Senior Policy, Research and Influencing Manager at the National AIDS Trust. He has 10 years experience working in the global HIV response and human rights. This includes being the Stop AIDS Advocacy Manager, coordinating Youth Stop AIDS, a trustee of Stop AIDS, and being the UK government civil society delegate at the 2021 UN high-level meeting on HIV and AIDS. Impressive stuff, James.
Well done, such a brilliant panel. We're looking forward to the discussions this afternoon.
Wonderful, thank you. So next, can we have Sara Paparini? Hello, Sara. Hello, I cannot actually hear you.
Hello, Susan. Nice to see you. And thanks for inviting me. After saying that I never forget to unmute, I just forgot to unmute.
Yeah, we just had a long chat about people who just mute themselves, and Sara never does that. So Dr. Sara Paparini is Senior Lecturer in Public Health and Equity at Wolfson Institute of Population Health, Queen Mary University of London, and the Social Science Lead for the SHARE Collaborative. Sara is an anthropologist working at the intersection of public health, anti-racist and participatory health research to achieve health equity. Her interests span intersectional health inequalities, particularly in sexual health, HIV, and other infectious diseases. Thank you for having such a tongue twister of a bio.
You're welcome.
Wonderful, thank you. And finally, can we have Eli Fitzgerald?
Hello. Thank you for having me. This is very exciting.
Hi, Eli. Wonderful to have you on. Eli is a transgender man living with HIV, having worked in and around HIV for the past few years, advocating for the rights of young people and trans communities. He currently works at Positively UK as their peer support integration manager. And is that a new role, Eli?
It is indeed. It is indeed.
Congratulations.
Thank you. Thank you.
Wonderful. So if we can have everyone on now, please. Fantastic. This bit is always a bit like the Brady Bunch. So the audience, for everyone watching on Facebook and Twitter, if you have any questions for this incredible panel, do please type them up, get them over, and I will try to pose some questions. So if we can start off around the Positive Voices survey, there was some recent data about the unmet needs of people with HIV in England, Scotland and Wales through the Positive Voices survey. James, what were some of the findings?
Yeah, so the Positive Voices survey from the UK HSA and UCL is the largest UK survey among people living with HIV. Roughly around 1 in 20 people living with HIV in the UK share their perspectives. I think a real key takeaway and really pressing for today's conversation is a level of key unmet needs that people living with HIV have in many, many areas related to their HIV care, their broader health and lifestyle, and other health conditions as well, too. And the last survey for Positive Voices was completed, I think, in 2017. And sadly, since then, there hasn't been really any change in the life satisfaction or the quality of life upon people living with HIV, which really urgently needs to be addressed. And the report highlighted that roughly 1 in 4 people had at least one unmet HIV needs, and I believe a third had one unmet social or welfare need as well. And the report also highlights some really deep and persistent inequalities within the UK's HIV response. So, for example, a key finding was that 2 in 5 people living with HIV had been diagnosed with at least one mental health condition, which is substantially higher than our general population. And the report, both for mental health, but also broader health outcomes, shows the real persistent inequalities around facing stigma that people living with HIV face and how that can intersect on their health and their health outcomes too. So, for example, I think around 1 in 9 people at one point last year didn't attend a healthcare service for fear and concern that someone might learn about their status as well. And as I'm sure we'll be hopefully discussing throughout this afternoon, the report does also highlight key communities living with HIV that are facing significantly worse outcomes. So, for example, the needs of the trans community living with HIV came out strongly as being unmet, and the need for the health system, politicians and policies to do a lot more to do that and to support their right to health, alongside seeing how systemic barriers and social determinants still have a huge impact on someone's ability to have a good quality of life. So, for example, the impact of poverty and not having suitable housing. And the report did also highlight that more than half of people living with HIV in the UK do not have enough money on a routine basis to cover their needs and the basic needs of them and their families too. So we're hoping at the National AIDS Trust that the report is a bit of a wake-up call to the UK government and devolved nation governments to see, whilst making so much progress in the last 40 years in the HIV response, there's still the pressing need to ensure that all communities can have a good quality of life, and the need to ensure that we do as much as we can at all levels to support the needs of all people living with HIV as well.
Great. Thank you so much, James. And we'll cover lots of those issues that James raises. But Sophie, if I can ask you first, an area of unmet need that came up in the survey was around long-term condition management. What are some of the challenges that people who have been living with HIV for a number of years face with their health?
Thanks, Susan. I think it can vary, obviously, for different genders. So for women, we have now been a few years into the fact that we're now living longer with HIV, and for women, there's a real lack of information, data, and whilst work is being done, what we're seeing through the peer support that we provide is a lot of anxiety for women about how they're going to manage their health when there's multiple comorbidities whether that be cardiovascular disease, where there aren't even any guidelines for women with HIV and cardiovascular disease. How women can look after their health from a really young age, whether that be their bone health. Obviously, a big topic is the menopause, but women have lots of other comorbidities that go beyond those. So there is a real need for a change in services, an improvement in services, especially for those outside London.
Yeah, thank you. Thank you so much, Sophie. That's a really important point. And Jide, do you think that people living with HIV from migrant communities face barriers to good HIV care?
It's not just people from migrant communities. In fact, I think that we need to look at it in a holistic way. And there are multiple communities that are being affected. The responsibility of One Voice Network, where I chair, is so that we can highlight or enhance the voices of Black-led HIV communities. There's no doubt, migrant communities are affected. Migrant communities do not have the information that they need in order to access, the services. We're even talking about, basic things of knowing where the clinic are, where to go, and how you need to register. That is why we're still talking about unmet needs. There are so many people that are actually not in service. They're lost. I mean, there are so many people that have come from abroad, for example, to this country, to the UK, that are not in service as well. The other thing that I think is also unmet, and I'm sure that we'll find it in the report, is culturally appropriate and culturally traditionally sensitive approach. We need that holistic approach for people that are living with HIV. We need those communities. One of the things that's also missing is adequate peer support as well. We need to ensure there's adequate peer support within communities. At the point of diagnosis, a lot of people are not connected to their own community in order to get the appropriate peer support. That needs to be challenged, and we need to be able to ensure that those services are put into place. People need safe spaces. When we're looking even in faith communities, for example, there are still people that are still not able to reconcile their HIV diagnosis with their religious spaces, with their faith spaces. That's been a challenge, for many people.
Yeah, thank you, Jide. That's really important points that you raise. And I'd like to pick up about peer support with Eli. I mean, that, as Jide said, that's one of the areas that was highlighted where there's high levels of unmet need. Why do you think peer support is so important, Eli, for people with HIV?
I think peer support is vital for anyone living with HIV. I think, peer support gives you that opportunity to speak to someone who is living with HIV, and it opens up that door to a wider conversation on a relatable level. So being able to sit down, and for myself, when I was accessing peer support, it was that whole thing of there is someone who sat in front of me that can relate to everything that I'm saying. And if not everything, they at least get it. And there's such an importance in high quality peer support that's equitable and people are able to access at any point of their care. And it opens up those conversations. It can move us past the point of wondering whether or not our sort of our own internalized stigma and the stigma and the thoughts that we have, having a safe space to communicate that with someone can enable us to be empowered, can enable us to overcome those barriers and take those steps into bettering our outlook on our own HIV, to better healthcare outcomes. So whether that's, if you're struggling with adherence, being able to speak about adherence with someone who's not necessarily going to tell you off for not taking your meds, almost like a guide. And I think peer support is vital in these barriers, and vital in educating, providing more time that you often don't get in appointments within clinics, and just helping us understand and how to navigate our HIV.
Yeah, thank you so much. And just if we can go back a little bit about issues around migrants and unmet needs. James, what's NAT's position on this?
So both completely agree, Jide, with everything you said so eloquently there. And at the National AIDS Trust, we work in partnerships to fight against policies and programs that have that affect the rights of communities disproportionately affected by HIV, including migrants living with HIV in the UK as well. I think building on Jide's point, we're still seeing in the UK the impact of hostile immigration policies on the rights and their healthcare access for migrants living with HIV. So whilst it's really welcome that now that everyone living in the UK can get free access to HIV treatment. NAT worked in collaboration on a report a couple of years ago on HIV and migration that found that policies like not having no recourse to public funds and not having the right to work, how that leads to destitution amongst people living with HIV and can also contribute towards disengagement from HIV care. So whilst the governments of the UK seek to deliver on their respective HIV strategies to be the first nation to eliminate new HIV transmissions by 2030, it's really important that we look at the broader inequalities and the broader social determinants of health and reform these really regressive policies that are having a detrimental impact on the UK's HIV response and the rights of migrants living with HIV.
Thank you. Thanks very much, James. And Sarah, can I ask you a little bit about, like needs as intersecting, particularly in terms of care?
So thanks, Susan. Yeah, I think listening to what everybody's saying, one of the helpful way of thinking about it is thinking about needs as something that changes over time, and people find themselves at specific crossroads that might then shape their need and whether it's being met or not. And I think sometimes services can be a little fixed. That's, for example, thinking of somebody as adherent and undetectable, and somebody, for example, as disengaged from care. Somebody is particularly vulnerable based on who they are. However, what we're finding in more recent research is that people fluctuate in and out of something like engagement, and then their needs can get much more complex at particular moments in time as well. So the SHIELD study, which is led by Dr. Darawan, and for example, is a study looking at disengagement from care, because we've observed that during COVID, some people living with HIV who were not attending or taking treatment as regularly were coming back into clinics. And so we did a study to try and figure out what was caused by that and how can services learn from that going forward. And what we see in the interviews and the survey is that we see that people do not necessarily perceive themselves as engaged or disengaged, at need or not at need. They go through different seasons, different periods, different circumstances on a spectrum, and the services tend to maybe be a little bit fixed in how they label people, where actually the kind of unmet need is underlying, and then you put something else on top, a particular situation in life, and that people can drop off the sort of spectrum of engagement in care, and also struggle with adherence at different times in their lives. So thinking also about what Sophie said, taking a long-term view, long-term condition management, thinking about all the different chapters on someone's life and how their needs will change based on who they are, but also based on what's happening with them. And we need to be a bit more responsive to that.
Yeah, thank you. That's a very good point. And I'd like to pose a question to you all. What do you think HIV services can do better to help people stay engaged in care? Would anyone like to take that?
I wouldn't mind, having a go at
Thank
that,
you.
Susan. And I think that there are a couple of things, and these are things that I have experienced myself, and both in services and also with the community of House of Rainbow. House of Rainbow supports Black queer men who are gay, bisexual, and trans people live with HIV, and we focus particularly on the Black community. And we created a program that we called Accountability Partner. An accountability partner has a number of purpose, and one of the purpose is to, match two people together to befriend themselves, and also, use that friendship to talk about, their treatment, to talk about and or reminding each other when to take their medication, and that can go on for maybe up to between 3 to 6 months, and that we try to create a pattern of continuity. Now, the second thing, which I have experienced in services, because I am a service user at George House Trust in Manchester, is HIV mentoring. HIV mentoring is very important because you have somebody who is using their own experience, to guide you, to be able to respond to questions. These are your peers, responding to questions that are likely to come up for you. And I think that is actually very good. It's not threatening at all. It's not clinical. And but the final one is also a good relationship with your healthcare provider, if they have enough time for you. And that is where we don't always have the time, with our healthcare provider.
Thank you. Yeah, that's a very good point. And very often in terms of what's going on in people's lives, it isn't HIV itself that may be the barrier to staying engaged with care. It's all the other issues and problems that they may be facing. And that's another issue that came up in the Positive Voices survey, was significant unmet social needs. How much do people think that unmet social needs is actually impacting on people's ability to live well and have good health? Sophie?
Yeah, I'd like to jump in there. Just because I did reach out to a community of women actually over the weekend to specifically hear from women who are supporting women in the community, and it's a huge unmet need in terms of housing support. There's a big conversation going on in terms of how we can improve immigration support for everybody. I'm hearing from the voices of women, and the intersections in terms of mental health, domestic violence. I know that can happen for everybody, and also something that's been touched on previously by Jide in terms of that culturally sensitive, appropriate services. And I mean, one of the things that the Sophia Forum has done in collaboration with yourself and Positive UK and UCL is to develop the GROWS programme, which is for women who are ageing with HIV over the age of 40. And I'll finish on this just to let other people respond as well. But women's organisations are globally the most underfunded services. And I think in terms of something that I would be saying today is there needs to be targeted services, campaigns, women-led, targeted funding for women, so we don't basically fall into these larger campaigns. We need that targeted work and that targeted funding for specific women's programs.
Mm-hmm. Thank you so much, Sophie. Yeah, that's a really important point. And women with HIV do face intersecting forms of stigma, discrimination, and disadvantage. And that's also the case for people from Black communities. And that's something that came up in the Positive Voices survey, was that needs such as like having enough food and having, adequate housing was something that was really impacting on people from Black communities. What do people think that's driving these racial health inequalities in terms of social needs?
I could make a couple of suggestions. I think there are a number of issues in terms of racialized discrimination as an underlying problem that people face. There is to some extent, lack of awareness about services and self-advocacy in terms of what can be accessed. I think the system overall, housing, welfare, healthcare, has become more scarce and more hostile. And wherever there is scarcity and rationing of services, then things don't fall equally, and people have to really fight for what is rightfully theirs. To be able to fight on all different aspects and all different angles in your life, it takes a lot of energy, and it takes a lot of it takes a lot out of people. So I think that there's always, what people are faced with, multiple intersecting challenges that are cumulative. I also think there is a weathering effect in terms of, particularly for people who suffered a lot of racist discrimination over the years. There is a kind of exhaustion that comes with that, and so it's a bit of a perfect storm of services retreating and public services becoming scarcer, and within that context, people also struggling to continuously have to self-advocate, which is where the community organizations and the peer support and advocacy is crucial, just to help people along the way.
Mm-hmm.
Thank you. Thanks. Yeah, that's a very important point, and I often say that systemic racism often is at the heart of some of these issues that we're facing. And James, what is NAT calling for to address the unmet social needs that we're seeing?
Yeah, just to quickly go back to Sarah's point on the challenges facing Black communities living with a risk of HIV. We think we understand these barriers increasingly more with the data from Positive Voices and such that came through. But in the context of these challenges, we've seen the funding provided to the voluntary and community sector over the past decade or so really decimated on the impact of austerity measures, and these austerity measures also having a real impact to the health of communities living with HIV, and particularly Black communities too as well. So one of the projects that Jide referenced in his opening remarks, the Unheard Voices project, which National AIDS Trust, in collaboration with the One Voice Network, coordinates, last month published a report called Unheard Voices, which explored the experiences of Black-led community organizations in commissioning of services on HIV and sexual health. We found the real impact of these funding cuts over the years, but also how still today community-led organizations aren't meaningfully involved in co-creation or consulted with when developing services and when putting out contracts to tender. So when we want to address these inequalities, it is really vital that the communities most affected have a seat at the table and can drive the agenda, as organizations involved in a One Voice network and elsewhere knows what works for our communities, but they're doing so much already, often with very limited funding. So we need the funding to go to the right places, but also to champion the experiences and the involvement of communities who are most affected too as well. And as mentioned, the National AIDS Trust is standing and still fighting in solidarity and in partnership to tackle the policies and programs that are having a disproportionate impact on people's health and health outcomes. So that includes trying to end policies around no recourse to public funds, as allowing the right to work, and pushing all organizations to develop stronger internal and external policies to tackle racism and stigma as well. And if anyone did want to get involved and support our campaigns, you can sign up to join our activist network through our website.
Great, thank you. Thanks very much, James. And Jide, for lots of people from Black communities, faith can be incredibly important. But do you feel that there's adequate safe spaces for people living with HIV in terms of faith?
I think I can say it right now, and anyone can dispute that later. There's actually zero safe spaces within the faith communities for people living with HIV. people living with HIV have to be self-organized outside of those spaces. You understand me? Aside from some of the churches that do World AIDS Day, the people living with HIV are completely forgotten for the rest of the year. And I think this is where the problem also begins. And I think that the reality is that people living with HIV, we need that constant reassurance in our safe spaces that we will not be ostracized, we will not be discriminated against. You understand me? We will not be mentally and emotionally or spiritually criminalized. And I think this has also impacted on our mental health and our well-being. I mean, the reality for many people is that, you know, I'm a person living with HIV myself, and I'm also a person of faith. I mean, my faith was actually part of the reason that I'm still standing today. And I think it's important that people of faith have the opportunity to reconcile their faith and their HIV status as well. And we need that safe spaces. A lot of religious leaders are extremely ignorant, about HIV, and that needs to be tackled. I mean, thank you so much, James and Sarah, because you've been talking about policy and study as well. But I think that what I want us to do also make you think about is the reality of bringing those studies into effect, because there is massive lack of funding. I mean, the study tells us about what's going on, but where is the funding to ensure these needs are met? Where is the policy to ensure or to make sure that commissioners and local authorities are pushing the budget, as a priority to support people living with HIV locally? Those are
Mm.
really important things. We need to change the way that we look at quality of life. The quality of life of people also includes the fact that they are free in all of the areas of their life to be themselves and be able to talk and live their life as people living with HIV.
Mm.
Yeah, thank you so much, Jide. That's such an important point. And we've got a question that's come through from the audience, and I think I will pose that to Eli. Eli, what would you say initially are some of the unmet needs of children living with HIV?
I think some of the unmet needs would be those to do mostly with aging and growing. I think, when we look at aging in HIV, we often look at those sort of 40, 50, 60, and there's almost nothing for anyone who has grown up living with HIV, going from childhood to adolescence into early adulthood. So I think being able to address those life stages, and I think, we've spoken a little bit about how people need different support at all stages in life. And I think for any child growing up with HIV, ensuring that those sort of, when that time comes, that there is someone who is going to be there and is going to stand with you and go, I've got you, and we'll go through this together. And that includes things like transitioning from your pediatric care to your adult care, understanding your HIV, understanding what that entails, and knowing why you're taking medication. Because without this education, without this information, often that does lead to disengagement within clinics and disengagement in care in those teenage years. But additionally, and more so, in childhood, HIV is often not spoken about. It's something that, in childhood, HIV itself is a family issue, and in that, often you're looking at a parent and a child, and just them living with HIV in a household. So it can't be spoken about, it can't be discussed in that space. And because of that, that leads to secrecy, that leads to issues with trust, that can lead to a lot of sort of unknown early childhood traumas where there's so many secrets inside and at home. And they're not bad secrets. Having HIV is not a bad thing, but it feels like it. That for many, it does. It feels like it's this awful thing that you can't talk about to anyone. You can't access support. You can't tell your doctors. You can't speak to anyone about it because it's kept so quiet. And I think it's important to recognize that whole thing about aging, because as young people grow, they age, and they age on medication, they age through their HIV, and that HIV can take a hold at different points in their lives. And then there's just that whole variety of things that happen in your teenage years, like dating and sex and wanting to go out and sleepovers and all that kind of fun stuff. And I think, most of the actual information out there is tailored towards adults who are living their adult life. And Shiva do a brilliant job at sort of bringing up some of this information, but I think there's still a lot that needs to be said.
Thank you so much, Eli. That's really helpful to be hearing that, particularly from you as someone that's like a young person growing up with HIV. And massive shout out to Chiva as well. And aidsmap and Chiva have developed some new resources. Sarah, what would you like to add to that?
I just wanted to add something that I say all the time, which is also that services, pediatric to adolescent transition services for HIV are in need of improvement. And one of the issues that have come up with research with young people is that when they're children, they're very much seen as this innocent, blameless kind of people who were born with HIV and so on and so forth. And then as they transition into adolescence, because they become sexually active, they become seen as potentially risky and potentially dangerous and potentially problematic and in need of being sort of managed more. And I think that there's a real problem there, which is re-stigmatizing people in terms of becoming quite strict about adherence, for example, becoming quite strict about sexual exploration and not really meeting the sexual health needs of adolescents living with HIV, and very much switching from this more paternalistic approach to the child to this quite strict approach to the adolescent. And I think that's extremely unhelpful. So there's this period to navigate where you're not an adult and you're not a child, but you're seen as someone to manage. And I think that can be quite tricky, and a lot of adolescents do drop off from care and from treatment during that time.
Thank you so much for sharing that, Sarah. I'm also conscious that globally, I think it's just under half of children living with HIV around the world don't actually have access or aren't on treatment. James, what are some of the global unmet needs that children with HIV face?
Yes, I did want to kind of contribute on this. So whilst, of course, we're still having our challenges within the paediatric response, as Sarah spoke to, the UK has made really excellent progress in the prevention of vertical transmission, and increasingly, despite some of the challenges, providing more holistic care for children living with HIV in the UK. But as you say, Susan, less than half of children worldwide, for the most recent data, haven't been diagnosed and aren't on sustainable treatments. And for what we understand, that if you're not on treatment for 2 years of the infant, half of these children will sadly die. But this comes at a time when funding for the global HIV response has been significantly cut. So more countries are tasked with kind of stepping up the global response, but without the adequate resources, with many kind of donors, including the UK government, pulling out of funding from key institutions like the Global Fund to fight AIDS, TB, and malaria. But with this treatment gap, it also highlights the need for further research into child-friendly HIV therapies that works for children and overcomes some of the system barriers that may be at play in particular low and middle income countries.
Thank you so much for sharing that, James. And something that's come up a bit is about the impact of stigma on people living with HIV. And an area that came up in the report about unmet needs was particularly around mental health. How much do you feel that stigma is leading to mental health issues for people living with HIV? If anyone would like to take that.
I don't mind jumping in, and I think that I was just listening to James, and thank you so much, for that analysis. And I think that the one thing that we can talk about both here in the UK and globally is that we need to address stigma. We need to address the shame. We need to address denial and discrimination. Those things are very important. We still have many countries around the world that criminalize sex work, that criminalize men who have sex with men, that criminalize the transgender community. How on earth do we think that people are going to go and get testing? We still have countries around the world where, you know, campaigning and promoting testing for HIV is not their priority, let alone, you know, prevention, let alone treatment. But of course, we also need to look at the connection with poverty in many places, and these are the responsibilities of the government in many of the countries around the world. But unfortunately, this has been left out, you know, to some of the funders who fund HIV treatment. But at the same time, I think that we also need to look at those population, the key population that are often extremely ostracized and mostly affected because, and you know, I've said so many times that people living well with HIV are not the ones transmitting HIV, but we are the ones the most that are affected by stigma and shame. I have been stigmatized and shamed even in the church, you know, by someone in the church. So let alone somebody who wants to go and test. You know, if you test if you go and test, that can lead to stigma on itself. Let alone if the outcome means that you receive a diagnosis. So that a lot more needs to be done to address, you know, and to destigmatize testing for HIV, to destigmatize living with HIV as well. So there's a lot more work that needs to be done.
Yes, thank you so much, Jide, for highlighting so many of those important points. And we're actually seeing that homophobic laws are actually getting worse in many parts of the world. And a group that really seems to be facing really harrowing experiences, even here in the UK, are people from trans communities. And that's something that came up a bit in the report, was the unmet needs of trans people. And Eli, what would you say are some of the unmet needs of people from trans communities?
I think there are so many unmet needs. We'll be here forever, but I genuinely one of the main things for myself and for other trans people is the absolute lack of support services specifically targeting trans people, specifically offering that peer support. And we know how vital peer support is. You know, I see it all the time. And when we do get sort of trans people come to Positively UK and speak to us, we can see the massive change that makes in them for the better. But I think, you know, we need something on a national and a global scale that speaks to trans communities, that says we see you and we are here for you, and offers genuine targeted support that's fully holistic, that caters for HIV, that caters for prevention, but also caters for gender affirming care, and offers a safe space for anyone accessing it. Because the moment we're being attacked from all sides, and you know, we see in the UK, especially at the moment, the whole thing about you know, the government, we're going to ban trans women from hospital wards or whatever and whatever. And you have to ask yourself, does that make, for any trans woman who's looking for a HIV test, are they going to go and get tested because that's in a hospital? And are they now banned from hospital? And you know, we see these sort of laws similarly around the world, and it's awful, and we need to do something urgently to tackle it, because otherwise we are not going to even be able to reach out to trans communities, because where are they going to be? Where are they going to go? Nowhere is safe. So I think making ourselves as open as we can is absolutely vital, and having an actual action plan, having actual services that are just for trans communities, that are run by trans people, that are peer-led, because that's just how the best things work, in my opinion. But yeah.
Yeah, absolutely. I mean, I agree with you 100%. Thank you so much for sharing that. And I'd like to loop back to something that Sophie mentioned briefly about domestic violence, and the fact that women with HIV are disproportionately affected. And I've heard, you know, in my work for aidsmap, going out into the community, some of the experiences of women who, particularly women who face other intersecting issues. So for instance, you're having no recourse to public funds. I'm hearing the most harrowing stories where women are feeling forced to stay in abusive relationships. And Sophie, can you talk to me a little bit about, you know, what you're hearing in terms of the impact of domestic abuse on the well-being and mental health, and even like the physical health of women with HIV?
Yeah, I mean, thanks, Susan. It's absolutely massive, and 2 minutes, I'm trying to condense it into 2 minutes is quite challenging, but just echoing some of what you've said, you know, especially those who have, especially but equally to those who have no recourse to public funds, and Black minority ethnic groups, those who have no status in the UK or awaiting asylum, are expected to live on £9 a week. And extra barriers to actually reporting the abuse and seeking help. And in terms of the mental health impact on that, it is absolutely massive. And in a recent survey, as you have just said, not the Positive Voices one, that especially Black women end up feeling trapped in relationships, and some of them stay in those relationships for like 20 years. And in terms of the broader socioeconomic impact of that, you know, alongside is the intersections of like the mental health. You have women have to leave the home in order to flee the perpetrator or the perpetrators of abuse, because sometimes it's not just one person, it can be family or it can be a partner. And then they're forced and sort of thrust into further poverty. And in terms of the financial abuse that can take place within the relationships, a lot of the time we hear about the withholding of finances. So I've heard many a time over the year where women can't attend their hospital appointments. And as we've spoken about earlier on today, it's like HIV for a big percentage of people is very low down on their priorities, because they are just trying to live, you know, day by day. And then the short and longer economic impact for women is that they don't feel able to return to the workplace, and that could be for a number of factors into the instability in their lives, whether that's through housing, whether through their mental health, they just don't feel that they're able to. And it comes back to, again, the role of peer support. But women that I see in both my jobs, the waiting lists for the special services is months and months. And we did last year, and the high levels of unmet need for women living with HIV who had experienced horrific sexual violence back in their home countries, who some were walking around with daily experiencing flashbacks, those who have experienced trauma from the genocide and they've seen families being killed. And someone that I spoke to, they wouldn't even consider discussing that with their HIV consultant, because they just don't see their clinic as a place to bring this. And so whilst there are screening that take place within a consultation, it's also about a much greater need in terms of those women's specialist support services, but also acknowledging that it's something that a lot of women living with HIV identify with, whether it's physical violence, psychological, sexual. There's so much. There's so much abuse that people can experience.
Thank you so much, Sophie. And I know it's difficult to cover all of that in this short period of time, because there are so many issues there. If I can just go back a little bit more about unmet mental health needs, what do you all think needs to change about the provision of mental health services so they're actually meeting the needs of people living with HIV?
If I can come in on this, just to add that NAT did a piece of research a few years ago on people living with HIV's use of generic general mental health services. And for when accessing NHS talking therapies, our research found that only half of people living with HIV found these services useful for them. And often this was drawn from experiencing stigmatizing behavior actually from NHS talking therapies practitioners, or not feeling that the practitioners had enough knowledge about HIV and their whole selves too. So driven on from this, the National AIDS Trust, working in collaboration with Beaver, Aviv Healthcare and others, worked with NHS talking therapies practitioners to develop an e-learning module to improve HIV literacy amongst mental health practitioners. The module was launched a couple of months ago, so very happy to share it on the chat if anyone want to take a look, or encourage any in your networks to engage with it as well. But in addition to improving the generic mental health services, I think it's still really important that adequate funding is provided for all HIV clinics to have an offer of mental health support inside clinic, and also funding and partnership with the voluntary sector, who of course we know do really brilliant interventions, both in counselling, peer supports, that can support the broader mental health and wellbeing needs among people living with HIV.
Wonderful. Thank you so much, James. And a question that's come in from the audience. I've heard funding has been cut to charities that help people with HIV. What can we do to fight this?
So,
Where should we start?
I think so. Sarah, James, Sophie, go for it.
Yeah.
So from my perspective, looking at research and also thinking about some of the models like the Improvement Fund for Fast Track City, I think one of the key issues to put community organizations at the leading end of partnerships with when it comes to service delivery and design, and when it comes to research. And so that's not a solution, but it's about understanding that the communities need to lead and lead first in all the HIV response, because that's where all the safety net is, and that's where all the holistic care takes place, and that's the kind of the only way to really design appropriate services. So one way is to make sure that funding starts with the communities and organizations, and then they partner with institutions, rather than the funding goes to institutions and services and the community organizations get some sort of subcontracted setup, which is usually short term and competitive, which is a problem.
Thank you. Yes, absolutely. We should be letting communities lead, as you and Aid say. James?
Completely agree, but sadly, the funding models and commissioning approaches that we've seen for the last 10 years in England haven't been letting communities lead. What we've seen from austerity measures the last 10 years is a real underfunding of community-led interventions that have been critical in supporting the health-related quality of life people living with HIV, and also often ill-planned commissioning changes and approaches that have left some vital services underfunded and slipping through the cracks. But we do have some good opportunities coming up in the next couple of years. There's going to be changes in the way that HIV services are commissioned in England, with them being pushed out to a local NHS integrated care boards across England. So whilst this comes with real risks that National AIDS Trust is trying to better understand and advocate against, it also provides an opportunity to ensure that commissioning and funding of services hopefully will be more driven by local needs and goes to the places where it has the most impact. So for the question in terms of what someone to do to get involved and to fight this, this is something that a project led by the National AIDS Trust, HIV Outcomes UK, which is a coalition of HIV experts working on issues around health-related quality of life of people living with HIV, is trying to look at over the next year. So please do sign up for our newsletter, where we'll share our latest events, workshops, opportunities to get involved as well. Whilst we consider the UK picture, as I mentioned earlier, we mustn't forget about the global response and how globally we've seen a real chronic underfunding for community-led interventions who are doing such brilliant work, often with such restricted funding and with such broader barriers, as Jide spoke to, in terms of the criminalisation of LGBT plus people in other communities too. So an opportunity we do have coming up on the next couple of months of this is the replenishment for the Robert Carr Fund. So the Robert Carr Fund is the largest funder of community-led key population civil society networks. So we're often fighting for advances of human rights against the draconian LGBT laws, but many governments aren't funding it currently, including the UK, not sufficiently too. So anyone did want to call for funding to be increased to communities, please to look at Stop AIDS' Twitter account and website, where in a couple of minutes you can write to your MP to call for the UK to step up and support communities internationally.
Wonderful. Thank you so much, James. We've only got 4 more minutes, so a couple more questions. Something that's come from the audience. Do you think that injectable treatment will help in terms of the unmet needs of people with HIV? Would someone like to answer that quickly?
So we've just finished a study about injectable treatment, and the top line finding is that yes, the removal of the need to take the pill every day and the kind of added freedom to move around and then not the lack of a daily reminder of the pill do improve kind of quality of life, and it does really open up lots of possibilities for people, particularly with regards to stigma, in terms of less fear of exposure through the pills and so on. However, there are some inequities that we will be publishing from the Ilana study in terms of how the improvements that we've seen are very different depending on race and gender of participants. And so we can say that the injectables help address some unmet needs, but can't address all of the unmet needs. But I think they're a welcome relief for many. And I was personally surprised because the people in the study are all people who are, as they say, successful on their treatment. So we imagine them to be adherent with no issues, but actually the relief they experience shows you quite how difficult it is or challenging it is to stay adherent and undetectable over the long course. So even those who we thought were doing really well, really actually were coping a lot of the time. So it goes back to this idea of the long-term condition. But yes, it does help for many people, but not equally for all people.
Fantastic. Thank you so much, Sarah. And we've only got 2 more minutes. So I've got the final quick fire question. I'll start with you, Eli, and then if we could go round. If you could pick one action to address one of the unmet needs of people living with HIV face, what would that be? Eli, you first.
That's a big question. It's such a short space of time. I think if there was one action, I feel like I'm on the spot. I think it would just be to open up further conversations and push for more peer support nationally. In all honesty, peer support is genuinely that thing that will help people through so much without even realizing, because it feels almost just a bit like a chat, and I think that's what a lot of us need almost, which kind of sounds like I'm minimizing things, but anyway.
Okay. Thank you so much. And if we could all stay on screen, we'll quickly go around. James.
So I completely agree with Eli. Commissioning of peer support and more broader HIV support services across all of the UK, and ending the postcode lottery of what services are available in different parts of the country. But we mustn't also forget about the structural barriers and that affect people's right to health, and how that must be challenged at all levels.
Fantastic. Sarah.
I think what we said before, community sector, community organizations, co-production of services, co-production of research, fund peer support, participatory action all the way.
Wonderful. Thank you. Sophie.
Well, without jumping on what the three previous speakers have said, what I feel needs to be able to enable that is a massive investment of funding that is equitable in the distribution of the funding, so it reaches all the community that needs the support. And I think, you know, we really need to shout for that. And I think, as I said, that will enable what the previous three people have spoken about.
Wonderful, thank you. And finally, Jide.
I mean, I think for me, it's also around the peer support. And I think if we can look at the increased peer support for migrants and adequate information for migrants, I think it will complement all the work that we're doing, and it will promote the holistic approach that we're all dreaming about.
Wonderful, thank you. And we are out of time. I'd like to thank you all so much for sharing your incredibly important insights. I'd like to thank Disruptive Live for their technical wizardry in making this happen. I'd like to thank everyone who's watched today on Facebook and Twitter, and the next aidsmapLIVE will be next month, and we're going to be talking about sex and HIV. So do join me for some sex and HIV in June. Thank you all so much. See you soon. Bye.